Yeah, it is a long history that became successful in this meeting, in which we searched for a very rare but predominantly alteration of FLT3 positivity in internal tandem duplication in acute myeloid leukemia, which is 40% of acute myeloid leukemia. When the patient relapsed, this abnormality becomes higher than 40%. So it's totally mandatory to get new drugs targeting the FLT3 internal tandem duplication. That was the case of Institute 20 at the beginning. Now it's called Quizartinib. It has been produced by Daiichi Sankyo. And finally, we get the phase 3 randomized clinical study. Quantum MER is the name of the protocol, demonstrating that the population treated with this inhibitor has a great advantage in survival and overall disease survival. So it is a very successful. Since I was involved from the phase 1, I get a paternity of these drugs for a long-lasting time, and I'm very happy to be able to produce this data that will be presented by Professor Di Nardo on Saturday in this meeting. The population was acute myeloid leukemia affected by relapse or refractory first line or second line refractory population, which has a FLT3 internal tandem duplication or mutation, and this alteration may conference very truly resistant to conventional chemotherapy. This is usually a population very young, with an acute myeloid leukemia, which mostly of the case is also refractory to allogeneic bone marrow transplantation procedure. So very poor people. And finally, we demonstrated that these drugs is able to totally reduce the amounts of cells to prolong the survival, to prolong the event-free survival. It's a new mechanism, which is totally new. The drugs makes differentiation of the majority of the cells. So at the beginning, it's not a truly curative. It takes a bit of time to be curative, but it is exceptional, comfortable for the patient, because the patient could be treated with safe and efficacy. It is also a drug for elderly with acute myeloid leukemia. Mostly of the population were elderly, they don't have any treatment, any opportunity, any case, so it could be very nice to get this drug for this population. This was a multi-center international clinical phase 3 randomized study in which involved more than 500 patients with acute myeloid leukemia, and the patients has been randomized 2-1 to be treated with these inhibitors, which we developed in several times. When we started to use this drug, the dosage of the drug was higher. At the beginning, I treated my patient with 210 milligrams square meter. It was an oral formulation then, and we reduced progressively the amounts of drugs. Then we do another clinical trial comparing 30 milligrams versus 60 milligrams. And this was the final dose that we selected for the phase 3 randomized study. The patient takes pills 1 time a day. The drugs is very well tolerated. There was a bit difficulty at the beginning for the heart problems that sometimes getting these drugs at home in a elderly population with concomitant medication can arise. But now we get a final approval that the drugs is very effective, even if we use a low dosage in the elderly population. So the final dosage will be 60 milligrams, which has been taken 1 time a day by this population. And they demonstrate very highly impressive data due to the fact that the majority of the patients, more than 60% of the population get CR in a short time, which means between 15 to 17 days. Not infection, not particularly cardiac problem, not neurological problem. So the majority of the patients tolerate very well this drug.